Why your filler doesn't go away, what actually happens over time. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. Most people are told dermal fillers last 6 to 12 months. But what if I told you, some fillers can still be present years later? Not always visible, not always causing problems, but not completely gone. Today, I'll explain what actually happens to filler over time, based on science, not marketing. The common belief: when patients get filler, they're usually told, it dissolves naturally over time. And that's partly true. Hyaluronic acid fillers are biodegradable. Your body does break them down. But here's the problem: breakdown does not always mean completely disappears. And that's where misunderstanding begins. What science shows, MRI evidence. Recent MRI studies have changed how we understand filler longevity. These studies show filler can still be detected years after injection, even when the patient thinks it's gone, and even when the area looks normal. This is especially common in areas like tear trough, mid-face, and lips. Why? Because these areas have complex anatomy, slower metabolism, and different lymphatic drainage. So instead of disappearing quickly, filler may persist in small amounts over time. What actually happens to filler? Let's break it down simply. After injection, 3 things happen. 1. Enzymatic breakdown. Your body produces enzymes, like hyaluronidase naturally, that gradually break down hyaluronic acid. But this process is slow, variable, and different in each person. 2. Integration into tissue. Filler doesn't just sit there like a lump. It integrates with surrounding tissue. It is water binding, collagen interaction, and tissue scaffolding. So over time, it becomes less defined, but not necessarily gone. 3. Redistribution, migration or spread. Filler can shift slightly over time. Not always dramatic migration, but subtle spreading. Movement along tissue planes. Accumulation in certain areas. This is especially relevant in under eye area and nasolabial region. Why this matters? Now, this doesn't mean filler is bad, but it changes how we should think about treatment. 1. Layering effect. If patients keep topping up every 6 to 12 months, but previous filler hasn't fully gone, you get accumulation over time. This can lead to puffiness, heaviness, and unnatural contours. 2. Delayed complications. Some patients develop issues months or years later: swelling, especially under eyes, fluid retention, irregular texture. Often, patients say, "But I haven't had filler recently." That's because older filler may still be present. 3. Misinterpretation. Clinicians may think, aging, fat pad changes, and skin laxity, but sometimes, it's actually residual filler contributing. Does filler ever fully dissolve? The honest answer: sometimes yes, sometimes no, and often partially. It depends on product type, injection depth, area treated, patient metabolism, and technique. Some fillers break down faster. Others can persist much longer than expected. What about hyaluronidase? Many people think hyaluronidase dissolves everything instantly. That's not entirely accurate. Hyaluronidase breaks down hyaluronic acid chains and softens and reduces filler. But it may not remove everything in one session. Deeper or older filler can be harder to treat, and the body still plays a role in clearing it. So even with treatment, results can be gradual, not immediate. Key takeaways. If you remember only 3 things, remember this. 1. Filler does break down, but not always completely. 2. Residual filler can remain for years in some cases. 3. Repeated treatments can lead to accumulation over time. Closing. Filler is a powerful tool when used correctly. But understanding what happens over time is just as important as knowing how to inject. Because good aesthetic outcomes are not just about today. They're about how the face evolves over years. Thanks for watching. Like, comment, subscribe, and share to support the channel.